Sepsis is a life-threatening emergency. The ISCCM theme for the year is to prevent, treat, and defeat sepsis.
Sepsis is a global health crisis. It affects 47 to 50 million patients every year. 1 in every 5 deaths which are happening worldwide is associated with sepsis. That means almost 2.8 seconds somebody is dying of sepsis. Let's defeat sepsis together. Let's end this sepsis crisis together. Watch this video and learn more about it.
Sepsis is a severe systemic response of the body to an infection, acute life-threatening organ dysfunction, which is potentially reversible, is the hallmark of sepsis. Unless diagnosed and treated early, sepsis may progress to life-threatening septic shock, multi-organ failure, and death. Hence, the crux lies in early diagnosis, resuscitation, and management, which can go a long way in saving lives.
हर साल भारत में 1 करोड़ से अधिक लोग सेप्सिस से ग्रस्त हो जाते हैं और उनमें से लगभग 30 लाख लोगों की मृत्यु हो जाती है। आओ संक्रमण से बचें, सेप्सिस की रोकथाम करें और जान बचाएं।
Sepsis occurs when our immune system reacts differently and a bit dangerously to an infection by microorganisms like bacteria, fungus, virus, or similar organisms. As a result of extensive inflammation, sepsis causes extensive tissue damage, organ failure like low blood pressure, kidney, heart, lungs, and nervous system failure, and even cause death.
At extremes of age, like preterm children or very elderly, frail patients are very prone to death due to sepsis. And there are certain disease factors, like if somebody has heart failure, kidney failure, liver failure, they are also very prone to develop complications of sepsis. Similarly, uncontrolled diabetic patients are also at a high risk of developing sepsis-related complications. And patients who have low immunity, like patients on anti-cancer drugs or patients on other medications after transplantation, are very prone to develop sepsis. Similarly, patients on steroids for a long term can also develop sepsis-related complications.
It is absolutely possible to prevent sepsis if we can maintain clean and good hygiene, practice regular hand wash, can detect sepsis early in a patient who has got infection, and can start vaccinating the adult as per vaccination program. This can definitely reduce the incidence of sepsis and can prevent sepsis.
If your patient has got fever or hypothermia, if your patient is confused and drowsy, and if your patient is having high heart rate and respiratory rate, then these may be the early signs of sepsis, and he or she may land up with problems.
Sepsis is very much treatable. Outcomes are excellent, especially when the patient is treated within the golden period. So please do not self-medicate yourself. Any sign of sepsis like fever or drowsiness, you're feeling really very unwell, fever is being just the last many days, consult your doctor at the earliest so that you have the maximum benefit of the treatment when it started within the golden period.
Self-treating with antibiotics can be harmful. Antibiotics are powerful medicine and they should be used under the doctor's guidance. Overusing antibiotics can lead to antibiotic resistance. Whenever you feel unwell, consult a doctor for the treatment. Let's preserve the antibiotics for ourselves and for future generations by using them wisely. Together we can combat antibiotic resistance and ensure a healthier world.
Sepsis is a killer. Let's join hands and work together to prevent, treat, and defeat sepsis.